Okay, so we'll start with anterior thigh muscles, which flex the hip joint. So here's psoas major and here's iliacus. So psoas major, you can see it attaches to the lumbar vertebrae and also T12. So it's attaching to the transverse processes, a bit of the intervertebral discs, and also onto the bodies. So this muscle goes down, it crosses the anterior aspect of the hip joint, and it'll go down and attach to the lesser trochanter. So psoas major combines with iliacus. So here's iliacus, which is on the iliac fossa, and here you can see it's a bit cut. But once psoas major and iliacus come together, they form iliopsoas. Okay, so both of these go down and attach to this common insertion, which is the lesser trochanter. So on our lower limb model, here we can see iliacus here. So we can't see psoas major because there is no vertebral column, but it would be over here. So iliacus and psoas major comes down, and once they go underneath the inguinal ligament, they form iliopsoas, which is right here. Okay, the one that I've just taken off is sartorius. So sartorius starts on ASIS, the anterior superior iliac spine. It runs over top of the anterior thigh muscles, and it goes behind the knee joint down onto the medial aspect of the tibia. Okay, so this muscle can produce movement at the hip joint and also down at the knee joint. Okay, so that's sartorius. The other muscle that also can help to do a little bit of hip flexion is tensor fasciae lata. So here's the muscle here. Here's the iliotibial tract. So this is the IT band or IT tract. This is the actual muscle here. And then the other one that you can see only a tiny bit of is pectineus. So here's pectineus, and lying over top of it are all kinds of vessels. So this is why you only can see a little bit of it. So these are the anterior thigh muscles which produce hip flexion. On the medial aspect of the thigh, we can see our adductors. So running straight down the medial aspect of the thigh, this one's easy to identify. This is gracilis. Okay, so this one's gracilis. More anterior, here we have adductor longus. And if we were able to take off adductor longus and pectineus, underneath it we would see adductor brevis. You can't see it on this model. Okay, so we have adductor longus, gracilis, and then here we have adductor magnus. So adductor magnus has two parts. It's a huge muscle. It has, here it's adductor part, and here's the hamstring part. So if we turn it here, you can see the other hamstring muscles are attached, and if we follow the hamstring part up towards where it starts, they all come from the same area, which is the ischial tuberosity. So this muscle is much larger than this here. It lies underneath all of them, and we can see a bit of where it goes down to attach onto the femur here.